9:02. Good evening, Facebook family and friends. I'm Cathy Novicky for Champions Over Cancer, and tonight is day 63 of my 90-day Facebook Live, and it is July 27th. And the reason I mention the date is because today, as I was scrolling through Facebook, you know how the birthdays come up, and on my birthday notification up came my microvascular plastic surgeon's birthday. And I don't know Dr. Marga's age, and I don't really care because her age does not matter. What she has done for me and what she has done for I don't know how many numbers of women and couples and families is so amazing that I instantly knew that I wanted to do my Facebook Live tonight about her. And if you don't know anything about plastic surgery, if the only thing you know is breast implants, that's plastic surgery. Well, they do a lot of other things. There are some medical conditions that require surgical intervention by a plastics expert. But Dr. Marga is so specialized that you travel to her. And how I was introduced to her was totally accidental. And I don't know what the chances are that I could recreate the series of events from when I learned about her and after doing some research and further educating myself on her and the procedures that she does. And then I went to 2 of her seminars before I had surgery, actually, and meeting her. She is a whirlwind of energy, personality, and doggedness. And I say it like that because she's famous for posting a couple of things. One is her mermaids, which is something that is unique to her. And if you go to drmarga.com, you will see her mermaids, and then you have to read about them. I'm not going to tell you. And the other thing is she has 4 little Bichon Frise, I hope I said that right, dogs. And when she operates literally out of 4 states, and when she travels with the dogs to keep her company. This woman goes from Chicago to Utah to South Carolina and to Louisiana. And that is after all of her training. She has established practices in those 4 states. And if you don't realize the struggles if a woman goes through to become a doctor. Now, I say this in only the thinnest of margins. I believe, this is my personal belief, so don't hold it against anyone else, but I believe women are capable intellectually and dexterity or whatever, absolutely to be a physician. But we are wired neurologically wired to care for everyone. Men are wired in a more compartmentalized way. And women who become doctors have a very hard time balancing work and life and having success. I don't know if success is the right word, but thriving in both of those environments. This lady graduated, I think she did her undergraduate at Duke. She is a through and through Duke fan, so never said anything bad about Duke. And then went on to do her residency and ultimately her surgical residency, and then went to plastics, but wasn't satisfied enough and added the vascular part and did fellowships. And we've talked on the more professional level about the number of words a day a vascular surgeon will use. And when you get to about 4 or 5, you start to not ask too many questions because you're not sure how many more answers you're going to get through the day. And this woman is so funny. She is personable, and she has developed such a following and is so skilled and talented, as well as supported by her husband, who is a physician also, and this lifestyle that they have etched out together. She's so supported that you go to her and you travel to her if she takes you on as a patient. And she said these exact words in the first conference that I went to. And she would tailor her content for the conference based on the majority of the people in the room, if they were more professional or if they were more patient, if there were more patients, and so she would be more patient oriented. And that is brilliant. So, but in this first one, there were more professionals, I believe. And this is what she said. She said at the end of the program, which is a whole day, she said, I only accept patients into my practice if I like them, if I like their spouse. If I don't, I will not operate on you. And I went, whoa, that's like turning down business, for lack of a better term. But in her explanation, she is spot on, and I don't blame her. Her explanation for this is because of the intensity of what the patient goes through and what she puts in, the effort and the time and the heart that she puts in to every single patient. If the fit isn't right, her belief is that she fears that she would not be able to give 100%. And that would be a disadvantage to you as a patient or you as a spouse, and she wouldn't want to waste your time. Now, this doesn't mean that she feels that you aren't entitled to this surgery. She just refers you to another physician, one of her colleagues. But to be as bold and upfront and outright with this statement is very refreshing in an industry that has a lot of ideas and issues and troubles with their transparency. But she doesn't, because she lays it right out there. Now, in a few minutes, there's going to be a little commotion because I see my daughter driving in and she has the dogs with her. So when that door opens, there's going to be a lot of commotion. So just be forewarned. But a little aside. So when I think back to how she had to go about and get to this level of expertise and the persistence that she had to do to get to that point, her passion, I like to call it, she was determined to bring breast reconstruction and vascularized lymph node transplantation to the United States. She read about, knew this surgeon in France who had been doing it but was retiring. And as she says, I know, I've already warned the viewers. Hi, boys. She almost stalked this woman until she convinced her to help train her. And she came to the United States and assisted on, I don't remember how many of the first of this surgery that Dr. Marga started to do. And I'm sure there were other surgeons that were doing this. But to hear her track and how she had to go about it and the advantages of it, where they take your own skin and they take your own fat, basically, hi boys, and reconstruct it. But because it's living tissue, they have to vascularize it, meaning they have to move an artery and a vein to each breast, if you're doing both, to feed it the blood, the oxygen, the nutrients that living tissue needs to survive. And that is not an easy task. She moved mountains. This woman is a super woman. She could run laps around 100 of us. And she just, I just smile every time I think of her because she is so funny, and she is just, once she takes you on as a patient, you are part of her family. And I knew I would talk about this tonight because A, she is an inspiring, aspiring, and empowering individual, and has created the life that she wanted, overcoming extreme obstacles, I am sure, knowing the conditions of training. And has also, oh, don't even say it, don't say it. This is nothing to do with this live. We're just gonna take a little deep breath. We're having a little child crisis, and I've got goosebumps now. But I can't even say what's going on because I'll just lose it. I'll just be laughing so much. We'll just close the door. So anyway, where was I? I can't. My daughter just opened the pantry door, and there is dead. Oh, there's a live mouse on one of the shelves in our pantry. We live in the country, and she was directly across from me, just beyond and she's totally losing it. I said, well, just close the door. She said, I'm hungry. Oh, just a little live entertainment for my live. So where were we? Okay. So she gets to this point, and she also, that was it, the work-life balance. She finds someone who she not only loves, but she can create a home life that works for both of them. And trust me, that it was my statement before about having a female physician and them, you know, the difficulties that they have separating work and life and finding a fit that is, now she's leaving. You know, it's just an amazing feat. And so I want, please, I'm not, this is just, the scenario is just so funny. I wanted to celebrate her life, and since it was her birthday, and I shouted out to her and I sent her a birthday wish, and she liked it and responded to it, that I knew that I just had to do the live tonight about her, because she has not only succeeded personally, but she has helped I don't know how many women, breast cancer patients, patients who have had radiation, patients who have had implant failure, which is huge if you've had if you have breast implants after mastectomy and have radiation. The percentage of implant failure is somewhere around between 50 and 100%. It's just outrageous. And then the complications that go on from there, it can be very sad and horrendous on top of what you've already been through. So I wanted to take this live and shout out to her and to everyone that follows me, that she shows that if you have passion for what you want to do, you can make it happen. You can overcome any obstacle, and you can improve the lives or the support, anything that it is that you want to do. And we need to tell the world about it, because that kind of work, it is very tedious. It has to be perfect, and you have to be so intelligent and so educated and trained and skilled and learned that she is a phenomenon. So I posted a picture before I went live, and this is, I'm calling out Yankee Candle on this too, because the Yankee Candle used to make a candle, a scent for breast cancer. And I don't think it was in collaboration with anyone, but it was, did this say? Oh, there's a little saying here, a passion for fragrance, and it was Yankee Candle, and it was only sold through Bed Bath & Beyond. And it says, light this candle in celebration of the strength of breast cancer survivors and champions, in honor of those who have we have lost to this disease. And I'm going to show it to you. There it is. I hope you can see it. It's a beautiful jar. I love the label. And the scent is called Mandarin Cranberry. And I want Yankee Candle to start making this scent again, because it is a wonderful scent. And this is my last jar, and they only made it in this size. This is my last jar, and after having written Dr. I'm going to light this candle, and I light it in honor of Dr. Margaret's birthday and for breast cancer patients and for breast cancer champions. So because this has all tied together for me today, and I am very, very excited. And so I am going to take a tub and light this candle and enjoy my tub. So I'm earlier than normal. I'm going to get to bed earlier than normal if I don't linger too long. So I am going to say that I hope everyone is home and safe, tucked in, and well. Tomorrow is Friday. It will be day number 64 of my 90-day lives. And I'm off, so you'll have to catch me when you can. And so to that end, I will say for Champions Over Cancer, I am Cathy Novicky, and I will see you tomorrow. And good night.